Good evening, everyone, and welcome to our third webinar for the SIL-Asia webinar series. If you need assistance, please use the chat window. And if you're having difficulties in configuring your connection, please log out from the session and rejoin again. You may use your phones or tablets to join by using the webinar ID 684101739. And for those attending our webinar for the first time, please be advised that all microphones are muted throughout the meeting, and for comments, please use the chat box, and for questions, please use the questions box. The Q&A will be held after the lecture. Tonight's speaker is Dr. Raymond Sarmiento. He is Director of the National Telehealth Center. He's also Chief Data Protection Officer at the University of the Philippines, Manila, and the lab expert at the Standards and Interoperability Lab for Asia. May we now call on Dr. Raymond.
Thank you, Charisse. I hope, are you able to see my screen now?
I think it's still loading. There. Thank you.
Thank you. So let's begin. Good evening, everyone. So tonight I will be giving a presentation on the importance of terminology services for semantic interoperability. I'm the terminology services expert for the Standards and Interoperability Lab for Asia, and I'm also clinical assistant professor for medical informatics at the University of the Philippines College of Medicine. So why do we need to understand data or information or terminologies in that sense? Healthcare is an increasingly information-intensive industry, and there is a need for the data and the information that we collect in the hopes of improving quality of care, to control healthcare costs, to improve health outcomes, to be able to use appropriate technology for patient care, and to compassionately and efficiently manage resources. Terminologies have been around for a long time in the health space. Coding and classification, they are integral parts of clinical practice, and the sharing of electronic medical records has emerged as a critical need. There have been efforts by multiple groups to conduct secondary analysis of data coming from electronic medical records, and they have discovered several correlations and associations in terms of the data that has not been discovered or figured out in clinical trials just yet. Terminologies help define the meaning of data and changes data to information through the use of semantic rules. So why do we need to code the data? The two important answers to that question is for translation. And why do we need to translate? It's because we need to understand what is being expressed. So in this example, I put in two sentences. The first one is, she is cold, versus the second one, she has a cold. You will notice that the terminology cold is quite different in terms of the semantic meaning for the first part and on the second sentence. The first one pertains to the temperature of the patient, and the second one relates to viruses or the condition or disease condition of the patient, and that is why the statement was, she has a cold. For data aggregation, we use terminologies, and you will notice that on the left-hand side, there are multiple terms for the same concept. The left-hand column pertains to terms which are spelled out in different fashions, but on the right-hand column pertains to concepts, or the concept ID is the same for each of the 6 terminologies that are presented here. So 222-98006 pertains to heart attack, pertains to cardiac infarction, pertains to myocardial infarction, pertains to myocardial infarct, pertains to MI, pertains to infarction of the heart. The middle one refers to a particular coding or classification system that is quite different from the one that is being used for the concept ID, and that could vary from one term to another. So why structured terminologies? Having structured terminologies provide consistent meaning, promote shared understanding, and facilitate the communication between systems, especially if you're looking to make them interoperable. It enables the comparison of data and integration of the different health information systems, and is essential for interoperating among those systems, applications, and institutions. They are also critical for sharing and for the portability of electronic health records. So you will, if you are using the same set of structured terminologies, you will not need to carry your own electronic health record from one health facility to another, because the understanding is that from one system to another, they will be able to communicate. That is why terminology is a critical requirement. And without the terminology standards, health data is made non-comparable. Data aggregation is quite difficult, if not impossible, as you would have noticed in that table that I presented earlier. Health systems are not able to interchange or exchange data. The secondary use of data for research and to facilitate efficiency is not possible. And the linkage to decision support resources will not be possible. There are certain clinical decision support systems that pertain to, let's say, an example would be info buttons. So you will not be able to collect or use or utilize the correct resource using that info button if you are not able to use structured terminologies when you're pertaining to existing concepts. For terminology standards and semantics, one of the fundamental goals is that of precise, number one. Number two, accurate and unambiguous communication. Ambiguity is actually the enemy of terminologies. It's for you to be able to understand if you're using one system that's different from another, having structured terminologies facilitate semantic interoperability. That means you are able to understand each other. Terminology standards provide the semantics of the concepts being conveyed in an electronic message or record. So let's say you are sending out an electronic message from your patient registration system to the laboratory information system, and to the health information system, and to the radiology information system. If you are consistently using the same terminologies, then they will be able to understand that for patient 1234, who was diagnosed with myocardial infarction, the patient had a CKMB of this or that value. The patient was given streptokinase within the last 6 hours, and the imaging findings show that the patient no longer has a blockage in his or her heart. So why do we need terminology services? We utilize the information resources to analyze and improve healthcare, and it depends on the organization and analysis of data from multiple systems. This analysis is hindered by differences in spoken language, the ad hoc mixture of structured and free text data, and the failure to define and utilize a set of agreed standards for the format and content of health data. Countries, for example, have their own take on coding classifications, such as ICD-10 and ICD-10-CM, and in-country ICD-10 modifications. In one of the countries that we are helping out as part of the efforts for interoperability of the Standards and Interoperability Lab for Asia, Vietnam has a different ICD-10 set for those that are found in the northern area and those that are found in the southern provinces of Vietnam. So those are things that the Ministry of Health and the e-health administration of Vietnam have been working on reconciling in terms of moving forward. Sorry. Next is how it works. Number one will be term normalization, which means understanding that from one term to another, you are referring to the same concept. So what is the SNOMED CT name? Let's say for heart attacks, the correct term will be myocardial infarction. If you are looking for translation of myocardial infarction to a more understandable code, let's say for billing purposes or for health information purposes, the ICD-9 code for myocardial infarction is 410.9. In terms of grouping and aggregation, is myocardial infarction a cardiac disease? Then the answer is yes. Those are the things that refer to a parent-child relationship in terms of concept hierarchy. Clinical knowledge, what drug treats a myocardial infarction? Obviously, streptokinase. And the local information will be what would be the local code for serum calcium. And serum calcium is one of the laboratory tests that you will need to perform in order to monitor the patient's response after giving the treatment and as part of his or her management for myocardial infarction, and adding that local information of L227 as part of their local laboratory code set is important. The next few slides will show the different steps in setting up your own terminology service. Number one will be selecting your own terminology service platform. You will need to populate the chosen environment with a larger data set. You will need to also focus on a particular subset. And for example, will be for pharmacy, mental health, toxicology, and all the other areas for terminologies. The chosen platform will be used to demonstrate and discuss environment-specific terminology data models and cross-mapping and sharing and governance in specific terms at a workshop. What that means is that if you're, for example, the different options that are out there in the market will be the Apilon distributed terminology services. They are able to provide namespaces for each of the coding sets or classification systems that you will need to plug in into your distributed terminology service. The other one will be Open Concept Lab. It's a fairly new terminology service, and it's part of the efforts that were spearheaded by the OpenHIE, Health Information Exchange Community. Another example will be the HL7 terminology services. So in our recent workshop and connectathon, Graham Grieve, who is considered the father of FHIR or FIRE, and the lead for HAPI, HL7 API for FIRE, Mr. James Agnew, they mentioned that there is a FIRE terminology services server that has been built using the HAPI API as a framework, but it does not have certain features, for example, like certain cross mappings that you will require as compared to Apilon in that sense. And then after conducting the governance in specific terms in the workshop and following that workshop, you will need to document terminology governance requirements. You perform a gaps analysis and author a development plan to identify and resolve unmet needs in the platform environment. It is very important that you will be able to engage the correct stakeholders. In the Philippines, we have been reaching out to clinical specialty societies, the Philippine Psychiatric Association, Philippine Pediatric Society, Philippine Dermatological Society, cardiologists, endocrinologists, Philippine Orthopedic Association, anesthesiologists. Those are the ones who we are engaging in order to populate the terminology services that we are setting up for the Philippines. We are using a people, process, and tools approach. So as mentioned by AHIN Chair, Dr. Bunchay, Kidsayanutin, people are far more important than the technology that's being used. So engaging the correct people and helping empower them and building their capacity and strengthening that capacity is far more important than the tools that that are existing in the process. But obviously, people, process, and tools are the integral elements to make this work in terms of deploying your terminology service platform. And finally, how will you be able to sustain and expand that? Like I mentioned, engaging the correct stakeholders and clinical specialists. If you are building a health terminology service platform is critical. And once it is up and running, the project will shift its focus to onboarding new terminologies. So at the outset, you won't be able to put in the terminologies, all of the terminologies that you will require in terms of the clinical specialists. Specialties. You will need to develop also cross maps and additional terminology content artifacts and integrate those into the terminal service with other e-health applications. So as part of the OpenHIE architecture, linking of the terminology service to the client registry, to the facility registry, to other components of the OpenHIE, and being able to establish a connection with the interoperability layer, those are important components to make an area-specific or region-specific health information exchange be possible or workable. During this phase, the sustainment and expansion phase, a fixed level of support for ongoing activities and optional targeted support, such as continued in-person workshops and training in support of capacity development, are recommended to be conducted. Having those capacity building workshops and training are significant activities in order to be able to sustain the level of interest and engagement, and in terms of expanding, if you want to expand the terminology service platform and the contents for that moving forward. Here's this slide shows the list of terminologies, 1, 2, 3, 4, 5. This is not an exhaustive list of all of the terminologies, but for drug terminologies, the Philippines has been working on PIMEDS, which is the Price Information Exchange for Medicines. It's a database for essential medicines all across the Western Pacific region. This project was in and has been initially and up until now is being supported by the World Health Organization Western Pacific Regional Office. It compares all of the drugs that are mentioned in the essential medicines package from one country to another, and the prices and how those prices fluctuate from one country to another. The second one will be for RX norm, and the third one will be for NDF-RT, the National Drug Formulary. Those two have been developed out of the National Library of Medicine in the United States, and have been several of them. Well, these coding sets have been used to develop value sets as they map to FDA standards. For UMLS Metathesaurus, it uses UMLS stands for the Unified Medical Language System, and the Metathesaurus indicates all of the synonyms in terms of the concept, the terminologies under a single concept, and this is actually one of the products also of the National Library of Medicine. SNOMED is maintained. It was initially developed by the College of American Pathologists, but is now being maintained by an SDO, the International Health Terminology Standards Development Organization, IHTSDO. You will need to have a license to be able to use SNOMED. For research purposes, you may be able to download it and use it and install it in your and deploy it in your terminology services. But if you will be using it beyond research purposes, SNOMED licenses are only issued to one entity and one entity alone in the country, in a particular country, and that is the Ministry of Health for that country. The Ministry of Health for a country may be able to provide licenses to those who want to seek a license for SNOMED. There is a cost for a SNOMED license per year that the ministries will have to cover, and I think it's based on the per capita the particular country. ICD-10 is for the International Classification of Diseases. It's being widely used right now. It's the 10th version is widely used right now. For meaningful use programs in the United States, they have been moving towards using ICD-10 codes. For LOINC, that's the Logical Observation, Identification, Nomenclature, Classification System. It deals with all of the laboratory terminologies and concepts. LOINC is arguably the best one out there in terms of laboratory concepts and terminologies. So thank you so much. That was only a brief presentation, and this presentation is a follow-up to the one that was given by Dr. Jack Bowie last week, who is from Apelon and who also serves as the Terminology Services Chair for the OpenHIE community. So I will turn over the microphone to Charis. Thank you.
Thank you, Dr. Raymond, for sharing your knowledge on today's webinar. I would like to ask you a question. How much does it cost to set up a terminology service server?
Hello, Dr. Raymond. Hello.
Hello. Were you able to get my response? Oh, I'm sorry. I think I got muted for a while. So my response to the question of Professor Rua then is that even though there are multiple options out there in the market, the prices for setting up a terminal service server is quite different from one to another. Open Concept Lab and the HL7 Fire server are free and open source. They do not cost anything, but it requires some heavy lifting in terms of the setting up, installation, and deployment and implementation of the servers. Apelon DTS is quite different. It's maintained by a private entity, and the subscription goes to mostly for capacity building and training in order for you to understand the importance of having a terminal services manager, an information systems manager, someone who will verify all of the concepts. So you will need to create a terminal services team, which is the recommendation of the Apelon company. And that subscription is an annual subscription for setting up the Apelon DTS. Okay, so thank you for that question. Over.
Thank you, Dr. Raymond.
So I would like to also note that in terms of the classification systems or coding systems that are important to understand, it will be the most critical part. The most critical of them will be SNOMED. Getting that SNOMED city license is actually it makes your TS implementation leap forward in terms of implementation. A lot of the cross mappings, especially in the health space, are heavily dependent on the SNOMED city cloud coding classification. Over.
Um, Dr. Raymond, I would also like to ask another question. Among the terminology services that you have given, which one do you recommend? Over.
Thank you for the question. It's quite difficult to provide a recommendation, although I am currently installing the Fire Terminal Services server using the HL7 API or HAPI framework. I have yet to fully explore that HAPI TS server. Although I've talked to the higher ups in terms of in the Fire community, and certain features that I would require as a terminal services expert are not existent. Like I said, there are certain cross mappings that you will need to perform beforehand before you're able to use fully the Fire TS server. Open Concept Lab has its own limitations also in terms of the name. There are no, I would say there are no particular namespaces that will be allotted for certain code sets that you will need to put in. But so as far as my experience, Apilon has the DTS of Apilon. Mine in terms of if you are using it for research purposes, it provides arguably the most complete set of features for you to be able to install. And as part of it, I think you're still able to use SOMID CT license in a research under the research umbrella, and as long as you are full exploring it, those are certain options in the market that are will be useful for your purposes. Thank you.
Thank you, Dr. Raymond, for that. Since there are no more questions before we close, is there anything that you want to say, Dr. Raymond?
Well, thank you everyone for those who have attended our SIL-Asia webinars. We will be conducting several more webinars in the next few days, next few weeks. So yesterday we had the one for client registry. A couple weeks back we had one for the importance of health IT governance and architecture. A lot of the future webinars that we will be looking at are those that are components that consist the OpenHIE architecture. If you are able to go to the OpenHIE website, you will have a fuller understanding of why this is one of the frameworks that's been recommended for by the Asia eHealth Information Network, and it's one of the benchmark models that the Philippine Health Information Exchange is built upon. So thank you, and we hope to be able to see you in future webinars. And thank you for our moderators also, and Charis and Ruwan then.
Thank you, Doc. But before we go, there's a question from Vladimir Choi. He asks this question: could you clarify what you mean by Fire Happy Terminology Service? Is it a single instance shared by multiple stakeholders, or is it a service you need to set up on your own according to the Fire and Happy specifications? Over.
Thank you, Vladimir. So the answer to your question is the second one. So you will need to set that up. You will need to install the terminology services. The easiest way is to set up a Fire server of your own in your own machine. There is a set of instructions in the Fire website. And if you also go to HAPI, the happy link in Fire, I recommend that you download the command line interface tools or the CLI tools to be able to easily install your own Fire server. And in your Fire server, you will need to set up the terminology services in that Fire server. So thank you for that interesting question.
Thank you, Dr. Raymond. So, are there any more questions that you would like to ask from the attendees?
Nothing from my side. I just wish that you'd be able, our current attendees will be able to continue to attend our webinars. Thank you.
So, since there are no more questions, we would like to thank you all for joining tonight's webinar. The next webinar would be on Monday, December 11. We would be talking about connecting the client registry to the interoperability layer. Ms. Pearl Gasman will be our speaker for that webinar. So thank you so much, everyone. Thank you for the attendees. Thank you, Dr. Raymond. Good evening, everyone.
Thank you again, and have a good night.